Hey, Dr. Ferguson coming to you from the Passioncam. We've been doing a series on Alzheimer's disease. And one of the challenges when you're beginning to think your family member may have Alzheimer's disease is making the diagnosis. How do you make the diagnosis? What do we need to do? Well, the first thing I would encourage you to do is see a healthcare professional that has some experience in working with Alzheimer's disease. Because early on, it can be a little difficult to make the diagnosis, particularly if you're not doing it on a regular or daily basis. Because it can be very subtle in making that diagnosis early on. But some simple things that you can do that can help you, that you can even do at home, is probably better if you have these tests administered by somebody who does them on a regular basis. But you can do what's called a mini cog. And in the mini cog, there's a couple of components. There's a clock and there's a recall of 3 words. So what you would do is you would give them the 3 words, tell them to repeat them right after you, and tell them you're going to ask them those 3 words again in a minute. And then you also will have them draw a clock. And when you have them draw the clock, you don't want to coach them at all. You want to give them a sheet of paper. You want to say, draw a big circle. Just do it in parts. This is not a time test. Draw a big circle. And now I want you to put the numbers on the circle for a clock. And once they've done that, now you tell them, I want you to make the clock say 10 minutes to 2 or 10 minutes after 2. And if they do have dementia, they won't be able to do this very well. They may look to you for help and ask, is this right? Is that right? And what you'll say to them is that, yeah, whatever you think is okay. If you think that's good, that's good. If, whatever you think. And so you want to try to have a poker face when they're doing that and not try to give them any hint that they're doing good or doing bad, but just a real poker face as they go through that process. And then when they're done with the clock, you want to ask them, what do they think of their clock? Do you think it's good, think it's bad, fair, average, okay? And that's a bit of information can be very helpful too on what they think of it, because that's not actually part of the mini cog, what they think of it. But that can be helpful to your healthcare provider in assessing the Alzheimer's disease. So then you'll grade the clock and you'll grade whether they got the 3 names right or not. And that, if they don't do well on the mini cog, that is very sensitive but not specific that they have some type of dementia. And that should get further assessed and evaluated. Another simple one you can do, I've never actually seen it in a book, so I don't know what the name of it is, but it was told to me by one of my colleagues some time ago. And that was, they modified a few of the tests that are out there, and the test is to have the person name 14 animals in 2 minutes. And you start your clock, and you can make a game out of it. You can say, I was listening to the radio, and they talked about naming 14 animals in 2 minutes and checking your memory out. I wonder, can I do that? And then you do it, and you say, okay, let's see you do it. So you make a game out of it, and then you have them name those 14 animals in 2 minutes. And a lot of times they may add in reptiles along the animals, things like that. So you don't have to get really strict on that. But if they're saying, you're asking for an animal and they're saying grasshopper, that's not exactly an animal. But so that you ask them to name 14 animals in 2 minutes, and you just write down what they do. If they get 14 in 2 minutes, then that doesn't say they don't have dementia, but further testing would probably be needed. If they cannot get 14 animals in 2 minutes, what I have found in my practice, that they almost for sure have some type of dementia. Again, sensitive but not specific. So they have some cognitive impairment when they're not able to do that. And so it's a couple of simple tests that you can do at home with your loved one as you're trying to assess them and get them into the doctor's office, or say you have one of those loved ones that just doesn't want to go to the doctor's office. That would be a starting point. If you did those things, that would be something you could tell your healthcare provider, and maybe they could help you to the next step. So on that note, Dr. Ferguson coming to you from the Passioncam. Be blessed and have a wonderful day.